Hi, everybody. Good afternoon. I'm Jahan Corbin. This is my friend and fellow survivor, Lynn Haddad, and we are the host of Banter. We're so glad you're joining us today. We're so happy you're here. We have an exciting topic to cover today. We're talking about rehab and exercise recommendations post cancer. We have a very special expert and guest speaker that we'll introduce shortly. This recording is put on by Breast Cancer Recovery in Action, a nonprofit organization headquartered in Middle Tennessee. And Lynn and I were both fortunate enough to be involved with this organization from its beginnings in 2021. But we are first and foremost a community for breast cancer survivors and patients. We are both survivors, as I mentioned, and love connecting people who have gone through this difficult and shared experience. The primary components of our program, I like to say the 3 E's. It's an easy way to remember it. We offer exercise groups twice a week with pink ribbon certified trainers. So they've had special training, additional hours of working with people who have had surgery on their upper body, lymph nodes removed, maybe tightness in their chest wall from radiation, all different ways to modify and still make progress and build strength after going through breast cancer treatment. We also have education, which Banter that you're listening to now falls under that umbrella. We try to provide a lot of value added content for our community that is relevant and interesting and helpful when you're navigating breast cancer. And the third E is emotional wellness. And that looks like small group setting for 8 weeks. We work through a curriculum together and talk about the emotions that come with a breast cancer diagnosis and how do we sort of move forward into a healthy and hopeful life without fear of a recurrence constantly or anxiety, but just the idea that we are able to process those feelings in a safe space with other people who have had a similar experience. So if you're not familiar with Breast Cancer Recovery in Action, or if you could use some of these resources, we would love to be a benefit to you. It is all free. So you're welcome to go to our website at BRA Groups, BRA groups.org to get more information. Breast Cancer Recovery in Action, the acronym is BRA. So you insert your supportive pun there. And that was on purpose to help you remember it. But brawgroups.org is where you can find more information. Thank you for joining us today.
Okay. I have the honor of introducing Dr. Klein Keyrose, who I may be calling that, or I might be calling her Dr. KQ, depending on what strikes my fancy at any given moment. Anyhow, we're very fortunate to have you. Thank you for taking time out of your busy day to join us today.
My pleasure.
Thank you. Dr. KQ is an assistant professor of physical medicine and rehabilitation at Vanderbilt University Medical Center. And she is also the only fellowship trained cancer rehabilitation physiatrist, that's a mouthful, in the state of Tennessee. So I'm anxious to learn more about that. And I wanted to offer you a very warm welcome, in spite of the fact that you attended Notre Dame for your undergraduate degree. So I have to tell you that I hail from the University of Illinois. My husband Greg hailed from the University of Michigan. So we are Big Ten fans. So I think we're possibly pitted against one another occasionally on the basketball. Are you field or basketball court in the football field?
That's right.
Are you a March Madness fan?
A little bit, not so much, a little bit more football, but thankfully it's not Ohio State or we'd both be in trouble. So we're good.
Right. We can find common ground there.
Yes, yes.
You like the Buckeyes? No, not.
That's great. That's great.
All right. Well, at least you're not an Ohio State person. I'm willing to take that. I think Notre Dame went abroad last year, didn't they? They had
We will occasionally go to Ireland to play.
Ireland.
That's right.
Yeah, that makes sense. Yeah,
that was the first game of the season or something.
Right. They do go abroad. All right.
Well, I feel like we're in the presence of a celebrity with all your credentials, and you're the only, what was it? I don't even know. The word you said, I thought, I don't know.
I felt very proud of myself for saying that. Right.
Well, I'm impressed. That's incredible. We're glad you're here. How did you get to Vanderbilt? What was the path to Tennessee?
So I was looking for jobs after finishing my fellowship in DC, and interviewed all over the country, with cancer rehab being a new subspecialty. A lot of the job postings are for, hey, come here and build something. And so when I was looking, it was really looking for a place where I felt like I could thrive and grow professionally, but also successfully grow and create a cancer rehab program. And one of the piece that really attracted me to Vanderbilt was its really warm, welcoming environment. It's a very collaborative spirit. And, especially with me kind of bridging different departments, technically being hired through PM&R, but I spend so much of my time in the cancer center. I was really looking for a place open to that collaboration and, clearly still, looking for that growth mindset. How do we continue to strive for excellence in providing high quality care for the people we serve? And getting to do so in an environment, right? We spend a lot of time at work. You want to be in a supportive environment. And I have now been here, it's hard to believe, 4.5 years. And that has very much helped through that gut feeling was correct. And it's been so wonderful to get to start something new, get to see it grow. And now we're continuing to grow and expand. And I can't wait to see where that takes us.
Wonderful.
That's great. I hope you like Nashville proper too, just as a,
I do. I do. It has really grown on me. I
yeah,
love that the winters are short.
yeah,
We get snow once, maybe twice a year, and the city
right,
shuts down, and then
right.
we're getting green already.
I was
Yeah.
gonna ask you if you were missing, if you missed the snow, but
Nope.
um,
So that one time a year, that
just
does it
enough
for
for
me.
weather appetite. Yes, and that's how my husband feels too. He's like, I'm tired of. I don't want to drive through it anymore. I don't want my car to be stained from it and all those
Mhm.
things. So, well, good. Well, so we're so glad you're here. So, could you tell us a little bit more about we serve the same space. Like we're both working in the cancer space. I'm just curious personally for you, what do you find the most rewarding about working with cancer patients?
Sure. So I really enjoy getting to know someone
Mhm.
and figuring out what are your unique goals and what are we striving towards. And so right with a lot of our cancer rehabilitation recommendations, and not necessarily that here is the one right best answer. It's this is our range of appropriate treatment options. What is the best option for this person based on their medical history, based on their goals at this point in time? And so I really love that I get that continuity of care and I get to celebrate in those small victories with someone, and regardless of what that might mean for them, whether it's being able to comfortably pick up a grandchild or being able to garden. And so it's really that individualized piece of getting to know someone and work together with them.
I love that. That's great.
That's really sweet.
Mhm.
I actually just have a follow-up question on that, which it's a little early, but I was curious, like, so when we meet people in our space, sometimes they're kind of beat down, right, after going through treatment. Do you feel like you can ever introduce the idea that they'll be able to do more than they expect? I mean, I feel like sometimes
Yeah,
people don't think everything is possible after cancer, right? It can be a hard situation to get through. And I would imagine, having been a patient at Vanderbilt, that I was able to get further than I ever imagined, you know?
good. Yeah, and I think I like to bring that aspect of hope to it, like depending on what that goal might be. Maybe it looks a little different than it did a few years ago, but if there's something you want to be able to do, we've got tools and options, and how do we work towards that? Doesn't mean we're always going to get there, but as much as we can, let's work towards that. And I want there to be an element of hope and exploring those options.
Yeah, the hope was that was the word I was thinking because I
Yeah.
think what I'm hearing you say is sort of that personal connection and what's important to each individual. It's really important to identify that and to set a goal for what's reasonable. Like
Mhm.
I can't maybe on our pre-call I may have told you this. I'm not sure, so forgive me if I'm repeating a
Yeah.
story, but I just know two things come to mind. One was a friend of mine that I met through this experience that used to be a Marine. I mean, she is a strong, physically strong woman and always had been. And after going through all of her treatment, she was having a lot of pain in her joints and she loves her dogs. She has a bunch of big dogs and love to walk them every day. And she couldn't like open the jar of the dog treats. And that became the thing that she wanted to work towards to get back building her strength. And so it was such a celebratory thing when she got there. And I know for me personally, I have 3 children. They were young when I was diagnosed, and I just wanted to be able to get out of the pool, like go with them to the pool and get out without looking like a 90-year-old. Like I was like, because when you go through, you recover 8 weeks after a mastectomy, you're not supposed to do anything or lift anything, and you lose a lot of range of motion and a lot of flexibility and a lot of upper body strength, no matter where you started. Even if you started in tip-top shape, you're just naturally going to lose some of that through this process. And then you add on, like the post-cancer meds and all those things that affect our joints. And so I just know for me, it was like, can I work towards getting myself strong enough where I can pull myself up out of the pool and not embarrass anybody, primarily
Yeah.
myself.
Yeah.
But I think that was it was just those small goals really make a difference. So I love hearing that connection you're making with people.
No, well, thank you. And thank you for sharing that piece. We had not talked about that before.
Okay.
So that was
Okay.
kind of,
That's wonderful. Okay. All right. So I have another question. This one is planned. So cancer rehabilitation specialty. Can you walk us through a little bit about what that means to those of us who aren't familiar with it?
yeah, no, and there's lots of folks who are not familiar. We're a relatively newer and growing subspecialty, so most folks don't know that we exist or what we do. In terms of coming from a rehab background, so physical medicine and rehab docs or physiatrists, we're really focused on that function and quality of life piece. So we treat a very broad spectrum of kind of diagnoses. A lot of folks after brain injury, spinal cord injury, stroke, also working with some like musculoskeletal bone joint kind of aches and pains. For cancer rehab, we're essentially taking all those general rehab skills and shifting it to a different population. And how do we take into account, hey, how does having cancer and the treatments involved in that potentially impact your function, how you're feeling, how you're moving, any pain, and oftentimes like risk of lymphedema and managing that. And so we want to make sure we're coming in, getting that understanding of that cancer history and treatment. So that way we know where we're at, and then taking that focus to focus on function and quality of life. So I ask a lot of questions about how neck, shoulders, how are they moving? How are you doing in terms of your strength? And then where can we come in? We collaborate really closely with a big team, much like our cancer care is a team-based, rehabilitation is team-based. And so we collaborate really closely with our physical therapists, occupational therapists, speech language pathologists, in providing targeted referrals to each of those disciplines as needed, thinking about, do we need to work something up further, like imaging, an X-ray, an MRI, or do we need to do electrodiagnostic testing to better study how nerves and muscles are talking to each other and functioning? Do we need to think about medications to help with pain or muscle spasms? Or sometimes thinking about injection procedures, which have a wide variety. And then also thinking about the need for assistive devices, adaptive equipment, kind of bracing needs that might help, again, focused on that function and how might those help optimize independence.
Do you coordinate with like the oncologist and breast surgeons too at all, or are you kind of discharged from that area once a person gets into rehab?
It depends. I do work pretty closely with them. And so in starting cancer rehab here, we did intentionally kind of embed my clinics within kind of the oncology care team space. And so because of that, I'm in a different space essentially every day of the week. So apologies to my patients that sometimes it is musical clinics. Where do you find me? Which day of the week? But that was done intentionally so that way I could be in that same shared space. That has helped with, oh, something funky came up. I want to run this by you. Like, let's talk about this and look at the MRI together. That has also helped, especially for our kind of newly diagnosed kind of breast cancer survivors, collaborating, and we are intentionally working on kind of in the near future building up and expanding more of a lymphedema surveillance and a prehabilitation model as an option. And so how do we help coordinate, getting you into at least some rehab options early on, even before treatment starts at times, and coordinating that to be done before surgery, or does it need to be coordinated while you're receiving the neoadjuvant or the chemotherapy that you might get before surgery treatments? And so there is some coordination of care in trying to be embedded within those teams.
Yeah, that's so interesting. So I'm curious about you talked about we kind of gave a great overview. I'm just curious about the pain and palliative care piece, if you don't mind elaborating a little bit more on that. I think that's something that's often misunderstood. And so I'd love to hear more about kind of what that looks like for y'all.
Yes. Oh, and so I'm gonna delve into it a little bit from there were previously published like Dietz's kind of categories for cancer rehab, kind of thinking about the different stages. And one of them is more of a palliative kind of setting, thinking about, hey, maybe this is something that's going to be long term and our goals aren't curative. Then how does that shift our focus and our goals in thinking, again, that function, quality of life, and that more supportive care piece? So from our end, like, right, what are those goals? How do we provide that support? Does that need to be some family training? Does that need to be equipment needs? And then we also will work pretty closely with our palliative care and supportive care teams, because they will then work on other things like, is there some nausea or some constipation involved? And so they are an absolute fabulous resource. I really enjoy getting to collaborate with them as well, and really thinking about who is this person as a whole and how do we help support you feeling better so you can do what you want to do, even if it is not the time that you had wanted or that we had hoped for.
So in that regard, then, are you dealing with people who are living with metastatic disease in addition to localized?
Yeah, so I will see
Cancer with
folks.
both, would it?
Sorry, what was that?
It would be both localized breast cancer and metastatic breast cancer?
Yeah, and so I'll work with folks at any time during that journey, from kind of time of diagnosis into active treatment, into survivorship, or kind of towards the end of life.
That's so great to hear. I know the metastatic community often feels like they don't have as many resources or specific care. And I will just say that one thing BRA is trying to do, we're trying to include so many, wherever you are in the journey, previvors, because you've had a genetic correlation with breast cancer, or current patients, or even those living with metastatic disease. But we have a monthly metastatic meetup, and those ladies are vibrant, and they have changed the way that I think about metastatic. So it's so exciting to know, like, you're working, to sort of just improve that quality of life, maintain really, just it's good. It's good to have those things available. So
Yes, big, and thank yous to our oncology teams and the new development of medications that are helping folks live longer. And so then from my end, from the rehab side, hey, how do we rehab and how do we support kind of strengthening and conditioning, even if, say, there's a bone met, right?
Right, yeah,
yeah,
right, yeah.
that's really
I
great.
think it looks different for every person. And it's a word that it's just, the connotation is like, okay, well, it's done, but it's not. It's, everybody looks different, everybody's situation is different, and
which is why it's so important that the cancer rehab space is so individualized. You can really modify it to each person that you're working with, it sounds like, which is great.
Yeah. And I think sometimes there can be a negative connotation with palliative care, as if it insinuates that we're giving up. And I wish it did not have that connotation, because I think then some folks may avoid kind of embracing that as an option. And it's really not giving up. It's, I think, a shift of focus and goals, and it's very person-centered. So it can be really beneficial.
Yeah, no, I think so.
Well, tell us about your training, just since it is a newer field. What did that look like for you?
Yes. So completed medical school and then went on to an internship in internal medicine, which then followed by a residency in physical medicine and rehabilitation. Within that residency, we get that training and exposure to general PM&R, as well as the different subspecialties. And so during that time, right, you're learning and exploring, what do I want to do general PM&R, which subspecialties kind of draw my interest. One of them as an option is cancer rehab. And so then following completion of residency, made that transition to a cancer rehab fellowship. And so that way we get some dedicated training and experience in better understanding of, hey, how does having cancer and its treatments can potentially impact function and quality of life, because that brings in a different component than we might not necessarily think about from a general PM&R perspective.
Mhm.
Is insurance coverage there for cancer or for like your services? I guess that sloppily, but I was just trying to think about, you talking about how it's a newer era, and when I think about survivorship and rehab, there are areas that are, I think, really newer areas of focus, right? And when I was thinking about, so many more people are surviving, right? We are just talking about that, and for longer. But we do know that treatments can have toxicities and can come with so many more issues. I was just wondering, how does, insurance and Medicare address this?
Yes. And so kind of my services tend to be covered by insurance just like it would for another kind of rehab consultation. Well, knock on wood, that tends not to be the issue. From there, when we're thinking about medications that would follow kind of our general kind of rehab and protocols, that tends similarly not to be too much of a challenge. Like sometimes some hoops to jump through. For our physical therapy, occupational therapy, similarly, we're doing it based on a documented impairment and diagnosis that should be covered, although that varies substantially insurance to insurance. So that is something to be aware of if folks are like looking for insurances or thinking about making the change. What each insurance company and plan might cover varies, and sometimes that is a little bit more restrictive. For some of them, as long as it is medically justified and appropriate, it will continue to cover therapy sessions. Others on the further extreme will say, hey, you've got a hard cap of 20 visits in a calendar year, and that's all you get. And I don't get to have any say in that, unfortunately,
Right.
even though it at times is very much medically appropriate and needed to have more beyond that. When we're placing referrals to therapy, our teams will then kind of run insurance, make sure it's in network. If we need to go to a different therapy site, we take care of that. So that way it's in network, hopefully minimizing copays, just because therapy visits do tend, you need more of them. And so copays can add up, which we acknowledge.
Right.
When we know that there is a hard cap, we try to be very mindful of that, right? And so if it's January, right, we want to not use all 20 of those visits because other things might happen. And we
Mhm.
want to make sure that we've got those visits. Um, we certainly try not to tailor our rehab around insurance, but it is kind of in those conversations, and we don't. Cancer is already financially toxic, and so we try to be mindful of that, even if it is in a less ideal setting, while having those honest conversations.
Right.
Um, the last piece I'll talk about with the insurance is going to be the injections. Most of them tend to be covered with appropriate diagnosis. The ones that I have a little bit more of a challenge with are going to be our Botox or botulinum toxin injections, because the covered indications don't necessarily fit why someone might need them after cancer in their treatments. Oftentimes, it just requires a little bit more work from thank you, our insurance auth team for doing all that paperwork. More paperwork and explanation from their end, or peer-to-peers, where once I usually get to another human being, another physician from the insurance team, then I can explain, hey, this is why we're doing it. So it might take a little longer to get that insurance approval, but we are almost always able to get it.
I just so appreciate providers like you that are willing to really go the extra mile and do that. And like you said, the insurance team, that's a job that I don't want, but the fact that they're willing to write it out and explain a little bit more, but it really makes a huge difference. So, because breast cancer is one of the most expensive cancers to treat.
That's been documented. And I think on the medical side at Vanderbilt, the social workers can sometimes help out with
Mhm.
like finding ways, to deal with the insurance and work out some of the issues. So they support, I'm guessing, your patients as well.
They
So
do. Yeah, we use the same
Right.
team. Yeah.
That's great.
exactly. I know that some of it is just getting the paperwork sorted and dotting the i's and crossing the t's. And it can be overwhelming to people, particularly people who don't have access to the smartphones and the computers and all of it.
Mhm.
And
Oh.
so I think that when in doubt, asking and getting referred to people who can help
Mhm.
can be
Yeah.
a big boon.
Absolutely.
Yeah, no, and we're growing and evolving. I know in the past, compression garment coverage for lymphedema has been challenging. Thankfully, Lymphedema
Right.
Treatment Act passed and went into effect, which is improving the situation. And I am optimistic, again, knock on wood, that it will continue to improve.
Do that,
I
right.
think that's been like, my mother-in-law wears a sleeve. She's a 35-year breast cancer survivor, and she wears a sleeve, and we're like, every time we go in, like now they've started applying for it, and soon it should be getting better and better.
Yeah.
I
Yeah.
think
Yeah.
everything is
Exciting to
moving
see,
forward. So
right?
I don't think
Encouraging.
we've actually gotten money back yet, but it's coming.
But you're moving in the right direction.
We
We know.
First act passed,
Yeah.
and they're
Yeah.
sorting out the paperwork and how it's all gonna work, and
Yeah.
but it's progress. That's how it happens, right? You
It's
can't
progress. Yeah.
all happen in one
Absolutely.
day.
Moving in the right direction is what we want,
Yes.
right?
Yeah.
Okay, so Dr. KQ.
This is the big
Did I
dog.
say that the right way? KQ?
Yeah.
Yeah, I was
I
like
I'd say that's the right order.
fearful that I messed up the letters. I was telling Dr. KQ before we jumped on that, before we started recording, that with my name being Jahan, I try to pay attention. Like when somebody has an unusual or hard to pronounce name, I try to, honor that because I know what it's like to spell and pronounce your name multiple times a day. So anyway, I am very sorry that I just questioned myself. I botched it. Okay, so switching gears a little bit away from insurance, but I know, and I think you have maybe something you want to share on the screen, but let's switch and talk about exercise. Obviously, that's such an important, everybody knows, no matter what it
Right.
is, breast cancer or something else, moving your body is important, right? But exercise being one of the primary components of our program, we know the value of really it's emotional and social in a group setting, but then there's also the physical piece and what it's really doing for your body. So would you mind talking a little bit about why exercise is so important to survivorship?
Yeah. Yes. And I will share
This is the big dog.
screen.
Big dog.
Yes.
Dun, dun, dun.
Good. All right. And so, I know, yes, I am biased coming from a PM&R background, right? We very much focused on therapeutic exercise and then how do we transition that? This is a really lovely, nerdy infographic from the American College of Sports Medicine. So if you're needing a little bit of nerdy motivation to help, like why should I be moving? Do I need to get out and do exercise? This kind of goes through it. And so what they've done in this infographic is show, hey, what are the potential health-related benefits to participating in exercise? And they've broken it down based on what the research has shown. So where we've got strong evidence and breaking it down by a mix of aerobic exercise, resistance exercise, which can be body weights, stretchy bands, free weights. If you don't have cans of soup, machines if you're going to a gym, and then the combination of them. And you can see we've got strong evidence that exercise can help improve cancer-related fatigue, quality of life, physical function, that the aerobic activity can help with anxiety, depression, still not at all a replacement for needed psychiatric care and support. They're fabulous. We've got a fabulous onc team at Vanderbilt, so shout out to them, as well as highlighting the safety piece of resistance exercises, as long as it's gradual and progressive, for that risk of lymphedema, as well as moderate evidence for the benefits of resistance exercises for bone health, and then moderate evidence that aerobic activity can help with sleep. So numerous benefits that you can see here broken down. Another way to view them is just on this infographics, again, supporting, hey, how do we get folks moving? These, I'll send the links, and that way you can view these. They're available kind of online through the American College of Sports Medicine.
That's great.
So when people finished working with you, does the average patient have their own protocol that they're going to go home and practice at home? Is that like a goal? Or, I mean, obviously at BRA, we offer, workout sessions twice a week, and we encourage people to work out at home on their own. Me, I love walking. I have 2 yellow labs, so I'm out with them every day that I can be, until honestly, I, I fall apart a little bit during the summer. It's just too darn hot.
It gets hot and humid here. Yeah.
And I'm
Uh,
really bones. I don't like the treadmill so much,
Yes. And that's kind of what you're saying, right? It's very individualized. So oftentimes when folks are seeing me, it's because there's some sort of limitation, some sort of pain component. And so first we start off with, hey, why is that happening? Providing that education, hey, this is the cause of what you're experiencing. What are our options to make that better? And then making sure we're doing so in a safe way, right? So if someone's got a rotator cuff tear, we want to help support pain-free range of motion first before we're then adding on those weights. Or say someone has a neuropathy that impacts the balance, making sure we're working on that balance and safety piece, because we wouldn't want someone to like fall or potential injure themselves. So we're taking those things into account while we're doing that kind of active treatment. But one of the goals from my end, if you're seeing me or after you're finishing up therapy, is that I want you to feel comfortable and confident with what a home exercise program or routine might need to be. And that is very personal. And what I will often say is, right, play with it. Start adding it in as you're going through the therapy. Figure out maybe working out in the morning or in the afternoon, or maybe calling it exercise makes you not do it.
Right. Yeah.
Maybe we should call it movement time. Absolutely fine. And then for me, yeah,
Time I'm not cleaning my house.
yes, or that. And it's because what I care about is that it's sustainable long term.
Yeah.
So I care a little bit less about, oh, it must be this specific activity. It is hopefully something you enjoy, whether it's going for a hike in the woods, a walk with your dog, swimming. And if you hate all of them, whichever one you hate the least, and then we pair it with something fun, like like a stationary bike in front of a TV. So that way it is very individualized, working towards reaching the goals from the American College of Sports Medicine, because that's where we're seeing those health benefits. But it does end up being individualized. But my hope for folks who are seeing me and going through therapy is that you're feeling comfortable, confident, and then do we need kind of resources? So like you all, I've got several folks who I know that have participated and had just a fantastic experience and have had tremendous benefit. And it's a wonderful resource because of that community and support to be able to do that exercise, especially if like maybe you didn't exercise at all before, and then I'm asking you to do something brand new, and that can be challenging.
Yeah, absolutely.
Yeah.
And I will say, we have members who come in that have never exercised a day in their life. We also, on the flip side, unfortunately, we are seeing younger and younger women who are diagnosed with breast cancer, and a lot of them, if they're in their 20s or 30s, sometimes they're like, I'm a marathon runner, I do CrossFit. I mean, a lot of them have their own rhythm that they've already been doing. And so that's fine. It's kind of like whatever's going to get you to do it. If you need to be alone, if you need to be with people, like whatever it is, let's do it and try to hold each other accountable and just move forward in that. So,
well, that's actually an interesting point, because Jahan and I were both on the younger side getting diagnosed, and we actually were both fit when we were diagnosed. So do you have something that you use to counsel people when you're talking about exercise and the importance? Because there is pushback. We're like, okay, I was living healthy. I was at a healthy weight. I exercised and I still got cancer. And people are mad, I struggled with that, honestly. I was, I was like, I did the right things and I got cancer in my 40s. Not fair. And
it's not fair.
and so I guess it's not on you, but then when you're like, okay, so why am I now sweating on a 90-degree doing something I don't really want to do?
Yeah.
So how is it that, and I get it's not for you to justify the way science works, but do you have something that you can tell people that, you still got to do it? Because it's a conversation, and we still are encouraging our members. We really encourage you to do this because it's good for you.
Yeah. I think acknowledging those feelings as being very real and very appropriate, and it's tough, right? You can do absolutely everything right,
Mhm.
Yeah.
and this can still happen, and it sucks.
Mhm.
Yeah.
And I think it's
Yeah.
hopefully allowing space for those feelings while still gently saying, even if that's the case, right? There's no shame or blame on any of it. It just, this is where we're at. Our goal then is to support you, and what the data shows is some health benefits, and how do I then get to partner with you to work towards those benefits?
Right.
Yeah.
So I don't
And
know if that's a great answer to your
well,
question.
No,
but it is, because I guess really the data really does show this, right? It's
it's
100%.
science.
You're
It's not
yeah,
just,
I
yeah,
know. That's what I need you to tell us.
Yes, yes.
It's
Sorry.
true, right? Because
It's
us
true.
sitting here saying this is us just saying it, but you're a
Yeah.
doctor, you study this.
Yes.
We're not making this up, right?
Right.
No.
But the human piece of, like, I love how you acknowledged it first, just
Yeah.
acknowledging those feelings. They are
Yeah.
real, they are valid, and so we don't have to dismiss those. I mean, I think, like, for me personally, my own conversation in my head for accountability is just, I will feel better mentally. Like, it helps keep me less stressed.
Mhm.
And I will just feel better all over. And I don't spend a lot of time. I don't know. For me, the motivation is not like
Yeah.
what size dress I wear, or how limber I am. I don't know. It's just you have to kind of, I think what we have to do is encourage each other to find your why, find your thing that's
Yeah.
going to motivate you. And I think I just know, like, if I don't exercise and I go through periods, like around the holidays, you know what I mean? Like, you'll stay, I'm going to take a week off, and then a week becomes a month, right? That happens. Is it just me,
Yeah.
or does that happen to
Nope.
other people? Okay.
That
So
happens.
when that kind of thing happens, and then all of a sudden in January, I'm like, why am I so depressed? Why do I want to cry all the time? Oh, I know, because I haven't worked up a sweat. I haven't been outside and gotten fresh air and sunshine and all the things that I know to do. So it's like, part of it is just figuring out what it's going to be that person's motivation.
Yes, and that is very individualized, and figuring out what your motivation piece is key.
Yeah.
Because that's what's gonna, me telling you there's health benefits, right? I'm not going home with you and making you walk with me. But it's how do we build that up? And you had brought up, like, hey, do we really have data? So I'm gonna screen share one more time.
Okay,
That's
please
good.
do.
All right, this one
How about the numbers? If
I
you
was
got
pulling up one of my older PowerPoints. Here we go. This is also coming from American College of Sports Medicine, from their roundtable.
Okay.
And so you can see here, and this is a little bit older, but you can see in terms of safety and efficacy and benefits, and the largest population of cancer survivors that we have numerous studies on exercise benefits is going to be for our breast cancer survivors. And so you can see here the numbers of studies that they reviewed. And again, this is an older kind of 2010 conglomeration. And so if this was the 2010 one, since then, there has been even more research, again, showing benefits for exercise. But just one more nerdy infographics for
I
y'all.
love it. Bring on the nerdy.
Yeah.
Okay.
Oh, did you have? I'm sorry. I thought you were.
Oh, sorry. Yep, there was just that one slide.
We were both like looking like.
Oh, yeah.
I mean, that's excellent.
It is. It's
because-
really good.
Yeah, I get it. And your guys are exactly right. People do need to find their why, but it also helps when it's backed up by science,
does.
because
Yeah.
sometimes it's easy to say, well, follow the good advice, which is eat well, exercise, and you're going to be fine. But for people that didn't work well the first time, it can be frustrating. And
Yeah.
Jahan and I do lead emotional wellness groups, and we've had the people who are literally tracking every glass of wine, who are tracking every step, and it's too much, right? And so we're trying to find the balance, and sometimes deal with the anger, and sometimes deal with the overwhelming pressure that this puts on them. And so it's this, I don't know,
It's a fine line of balance.
it's
Yeah.
a tug of war
Yeah.
in people's brains, and it's a complexity.
Yeah.
We want to
No.
offer the best advice we can.
That's right.
And tell them it's fact-based advice.
Yeah. And that finding that balance point
You've
Finding that
embraced
is
balance.
challenge.
finding the life that works for them.
And
'Cause we all work really hard to be here. You know?
Well, yeah, and you
You
don't
just
want to, it's
did.
sort of that 80-20 rule people say, about a lot of things, like you make good choices 80% of the time. I think that's that makes sense to me because I've seen people paralyzed, not being able to go, like, they panic if they have 1 gram of sugar, or they have given up whatever that they love, or even to the extreme of, like, we had one person that really struggled with going the car line to pick up her children. She didn't want to get out and communicate with any of the other moms in the car line when they were all outside talking, because she was afraid of the exhaust. And I mean, I just think there's a lot of things that come with this experience that you may never have thought of beforehand, because cancer kind of makes you neurotic sometimes. But we have to also enjoy our lives and have balance and be, what I mean? And there are people who come in and say, I've never had 1 drop of alcohol in my life and I ended up with breast cancer. So, it goes both ways, but just that balance is really important. Balance is a big.
Yeah, balance is important. And kind of on that note, just a little safety piece, right? Exercise and movement should not be causing acute sharp pain. If it is, that's the time to reach out to the healthcare team to figure that out, so we can figure out why and kind of work that up and treat it, so that way you can get back to exercise. Same thing, significant shortness of breath, chest pain, feeling dizzy or lightheaded, anything like that, making sure to plug in with your healthcare team. We don't want to restrict or say, hey, you need an medical exam to clear you for exercise, because that would restrict access to exercise, which we know is beneficial. But if you're having any concerns, definitely reach out to your healthcare team.
Yeah, that's a great disclaimer.
And everybody who takes part in our programs gets cleared by their doctor in advance. And we always encourage open communication with physicians during our program.
Absolutely.
And I mean, I think it's great to, find fun in addition to the way
Absolutely.
you're finding your why. For years, we used to walk frequently. Right now, our lives have gotten complicated. Teenagers are challenging. They just suck every minute out of the day.
They do.
I thought it was toddlers,
And there's
but it's
so
not.
many of them. I'm like, where did you all come
They're
from? My
multiplying.
groceries are gone.
But no, we did for years walk a lot, all the time, and it was just fun. It got just seeing each other's beautiful face would, get me moving, and so finding fun, whatever it is. And then I replaced it with 2 dogs, and now I have fun with them.
And they're much less chatty than I was.
They go whenever I want them to.
Oh, that's right. They're available on your schedule. Okay, well, I know we want to wrap up shortly, just because in the interest of time, I want to be very respectful of your time as well. But I would love to know, this is kind of a hard left here, but tell us about referrals to Diani, the clinic, and how people get to you. How do they refer to you?
Yes. And so different options depending on kind of what a person might be needing. For folks to see me, it depends a little bit on the insurance. Some insurances do require a referral to see a subspecialist, if that's the case. If they're the easiest is the internal. If you're already seeing a Vanderbilt doc, they can really quickly and easily send that referral for cancer rehab, which will get scheduled with me. If you don't need a referral with your insurance to see specialty providers, you can actually just call in. And there is also the option for online scheduling. I think if you Google me, you can find a link as needed. In terms of scheduling then with our physical therapists or occupational therapists, those require a different referral. So that can either come from kind of your oncology care team, your primary care doc, our cancer rehab specialized physical therapist are going to be over at the Diani Center, and that would be more of that physical therapy referral, or then I will place it if therapy is indicated when I see folks.
Okay, and just for folks who are local in Nashville, is the Diani Center, are y'all downtown where the Vanderbilt?
Yes. Yeah, it's downtown, kind of across the street from the Children's Hospital.
Okay, great. Okay.
But you move around in seeing your patients.
Yes, and
you're all over.
On which day of the week. So far, I've only driven to the wrong clinic one day so far. I've been like, oh, today is Tuesday, not this clinic.
Well, maybe we could include a link to Diane when we include the graphics that you included.
Yeah,
If
yeah.
somebody wants to look for you.
We'll put that, yeah, attach that with our recording so people can find it.
Yeah.
Well, this has been
All right,
so
thank you.
informative. You have taught me a lot and made me want to go out and exercise, which is hard to do, but you definitely motivated me to stick with it and be consistent. So thank you. And thank you for the work that you're doing.
Yeah. it's
Specifically
wonderful.
around cancer patients. It just means a lot. I really personally appreciate someone with your approach, compassionate and individualized, and I can tell, listen really well to your patients. And I just appreciate that so much. So thank you for the work you're doing. It matters.
Yeah, we've been very fortunate, I think, both of us, in how things have gone. And so we appreciate people like you who reach out and
Absolutely.
help bring forward the other survivors.
It makes such a difference. It's like, I mean, I feel like the person I can think of with as much impact outside of somebody like you is like the oncology nurses, like when you're going through infusion, but those
Yeah.
people become your people. Because when you're going through that season, it's hard and you need that sort of friendly face and that support. And so from somebody who knows what they're talking about. So we really appreciate it.
Oh, no. Well, thank you for inviting me and thank you for the work you all do. I know from direct feedback that it's very meaningful and rewarding and helpful to so many folks. So thank you.
Thanks. Glad
All
to hear
right.
that. All right. Well, you have a great afternoon.
Chatting.
Thank you for your time.
All right.
Bye.
Oh.
You good?
We go. Hold on.